February is Heart Health Awareness Month. It's not just important for adults to have a healthy heart. Parents need to be aware of children's heart conditions as well. And here today to explain is Dr. Celina Moore from West Boca Medical Center. Doctor, good morning. Good to have you here. How common is it for children to develop some type of a heart situation?
Well, I think the word develop is probably not the right word.
Okay.
I think it's how many children are born with heart defects. That's more common than actually developing them. And the incidence of that is about 1 in 100.
Wow.
So it's about 40,000 births a year.
So then how common would it be that something like this is left uncovered until later in life, sometimes as an adult, that it shows itself?
Right, the more mild heart disease, the congenital heart disease, are usually not found until later on when something else triggers an exam to look for that.
Okay.
Yeah.
What are some of the symptoms that you should look for as a parent if you think that your child has a heart condition?
Well, some babies are known to have congenital heart disease before they are born. So the parents already know about that. At birth, sometimes the babies are born blue, which is a big indicator to look for congenital heart disease. And right now in Florida, we are screening babies prior to discharge to make sure that they have enough oxygen in their blood, kind of as a secondary tip-off to make sure that they don't have congenital heart disease.
Okay, well here comes that word develop again.
Yes.
You mentioned that it happens while the baby is being formed, so that at that point is usually when it starts happening.
Correct.
Okay.
Correct. And the more mild forms of it sometimes don't get picked up until, when they're feeding, because feeding is a baby's form of exercise. So if the baby sweats while feeding, or if the baby seems to tire out while feeding, that'll be an indication to see your pediatric cardiologist. Other times it's just found on a physical exam by hearing a noise called a heart murmur.
Okay.
Yes.
All right. Well, I can't ask you to explain how that is, in terms of the sound and all that. But I was telling you during the break that a friend of mine that I went to school with had to stop playing football when he was like, I don't know, 18, 19, 20, because something was uncovered, and it was a heart murmur. And we were all surprised because this guy was, chiseled. He was really built and he was fast, and we never knew he had a problem. And obviously he didn't either. So something like that does happen.
It does happen. And the other type of heart disease that we can also see is not necessarily a mechanical problem with the heart, but sometimes an electrical problem with the heart, which is called an arrhythmia. And those sometimes don't show up until later in life either.
All right. So those are the common conditions that to look for as a parent. All right. Now we know. Lots of good information as always. Thank you so much.
You're welcome.